The committee will come to order, and good morning to everyone, and thank you for being here this morning, especially this hearing to examine the United States' contribution to the global fight against malaria. Leadership matters. In 2005, President George W. Bush established the President's Malaria Initiative, or PMI, and targeted several African malaria endemic countries to receive over $1 billion to mitigate and someday eradicate this killer disease. The positive consequences of that bold and compassionate initiative now includes over 1 million lives saved over the last decade. And of course, the program and its expansion and the sustainability of the funding has been all important in that battle. Although we will hear statistics about malaria cited several times during the course of this hearing, the global impact of this disease is so severe that they are worth repeating, and I say that even though we are making progress. The World Health Organization estimates that in 2010, there were 219 million malaria cases and 660,000 deaths. While still unconscionably high, every life is absolutely precious and of extraordinary importance. Loss of life has declined from approximately 985,000 deaths in 2000. Not surprisingly, malaria has a particularly devastating impact on the most vulnerable. Nearly 86% of those who die are children under 5 years of age, living in sub-Saharan Africa. Dr. Mark Dybul, Executive Director of the Global Fund to Fight AIDS and George W. Bush's extraordinarily effective Global AIDS Coordinator, says that in Africa alone, malaria takes a life of a child every minute. He also notes, as do our other panelists, that pregnant women are also disproportionately malaffected with the disease. WHO emphasizes in its World Malaria Report in 2012 that malaria is strongly associated with poverty. Countries in which a larger percentage of the population lives in poverty also have a higher mortality rates from malaria. Children living in poorer populations and in rural areas have the highest parasite prevalence rates. It is also important to note to the extent to which the prevalence of malaria is concentrated. 80% of malaria deaths occur in just 14 countries, and almost 80% of cases occur in 17 countries. Over 40% of malaria deaths occur in just 2 countries, the Democratic Republic of Congo and Nigeria, and 40% of the malaria cases are in the Democratic Republic of Congo, Nigeria, and in India. These high morbidity and mortality rates are not necessary. Malaria is both preventable and treatable. We will hear today from our distinguished witnesses who are leaders in the field about the cost-effective measures that are currently available and already having a profound impact or are in the development process. And the United States, despite the current financial constraints, is making a significant contribution to the global fight against malaria. In addition to our contribution to the Global Fund to fight AIDS, tuberculosis, and malaria, the United States provided $871 million in anti-malaria assistance in fiscal year 2012 alone, and the request for fiscal year 2014 is $893 million. But these levels, even when combined with contributions from other donors, do fall short of the global need. So our question today will be, what are the major challenges going forward, and how can we best use our resources to meet those challenges to save the most lives and have the greatest impact in controlling, if not eradicating, this dreaded disease? We will also be taking a close look at several immediate threats to global efforts to combat malaria. On April 19th, this subcommittee held a hearing on, quote, meeting the challenges of drug-resistant diseases in developing countries. In his testimony at our hearing, Dr. Thomas Frieden, Director of the Centers for Disease Control and Prevention, warned that in recent years, malaria infections in parts of Southeast Asia have been showing resistance to artemisinin drugs. These drugs are the last remaining class of antimalarial drugs and form the basis of malaria treatment globally. If these resistant parasites manage to spread to sub-Saharan Africa, he stated that the results could be, quote, devastating an assessment that will likely be repeated by our witnesses today. Insecticide-treated nets, bed nets, which have an average useful life of 2 to 3 years, are also an extremely important proven malaria prevention tool. According to WHO, 150 million nets are needed each and every year to provide protection to the vulnerable populations in sub-Saharan Africa. For the past 2 years, however, the supply has been considerably lower than this level, resulting in an estimated current shortfall of 77 million nets. The consequences, if not urgently addressed, could place entire populations, especially children, at risk of a dramatic malaria resurgence, and of course that means more death and more morbidity. We are fortunate, again, to have 3 distinguished experts who will provide us with valuable insights. These are truly leaders in the field, and I do hope, C-SPAN is here, and we are grateful they are here. I would hope that Americans would sit back and take note of the extraordinary work you 3 individuals are doing. People sometimes are very dismissive of foreign aid and initiatives that taxpayer funds are used. This is one of the greatest success stories. It's not the only one. There are many, but this is one of the greatest success stories, but it's a work that remains unfinished. And again, so I thank our witnesses for being here and for being such leaders. I'd like to now yield to Mr. Burr.